in the intense world of medical emergencies.
I'm worried that you punctured your right lung.
There's nothing more extreme than a code red.
He's been hit by that JCB vehicle there.
It means there's an immediate threat to life.
Any pulse? Can you just check?
No, I can't feel anything.
In the West Midlands, highly specialist teams are ready to react to these major traumas.
Patient's falling from top flight of the stairs.
By road.
Our ETA is about 2 minutes.
And air.
Patient has a large wound. Get affirmative, all received.
These emergency doctors and specialist paramedics
We're going to get you out, all right?
use cutting-edge trauma techniques in surgery, normally only seen in operating theatres.
John, there's some more very strong painkiller going in now.
To save people from almost certain death.
Celox, please, at major hemorrhage.
OK, stand clear. Shocking.
From car crashes...
Rob, I'm just going to lift your feet and we're going to look at getting you out, OK?
...to stabbings.
Gentleman has turned on Sean with a meat cleaver.
Filmed alongside the critical care teams,
If we'd have left it, your heart wouldn't have restarted.
we captured every vital second as these specialist crews work to save lives.
Let's get him on the ambulance.
Lift. OK, nice and high.
Honestly, trust us.
Tonight, a sudden cardiac arrest leaves a joiner fighting for his life.
OK, we're going to stop here.
I can't feel anything.
Jordan.
Dr. Jen deals with a man in the grip of a psychotic episode.
Calm down, Bruce. You're going to hurt yourself.
Yeah, big lump.
A giant printer falls on a man's head.
It's a rather large printer, isn't it, to drop on your head?
And a downhill cyclist suffers a devastating injury.
Where's all the pain?
So bad.
OK, darling.
OK, let's do a back quiz then. First aid kit.
In Birmingham, 3 critical care team members are starting their shift.
Here is it? No.
Dr. Andy Mockridge, advanced clinical practitioner Les Young, and senior nurse Emma O'Leary.
There.
They're part of the West Midlands Care Team, an emergency response unit staffed entirely by volunteers and funded by charity donations.
Ambulance service, is the patient breathing?
No.
So he's not breathing, he's not taking any breath, he's not breathing?
No.
And what's actually happened?
He's just complaining about chest pains, possible angina, and he just dropped unconscious.
Okay, just to confirm, he's not conscious, he's unconscious right now?
Yeah, he's unconscious.
So that we need to start CPR then, okay? Lying flat on his back, okay? Kneel by his side, put one hand flat in the centre of the chest, put the other hand on top and lock your fingers together, okay?
Yep.
Push, 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 push. Push, 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 push. Can you say that for me every time you do it?
Yeah. Push, 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 push. Push, 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 push.
A man's collapsed at a house on the outskirts of Birmingham, and he isn't breathing. It's a Category 1 emergency, and the critical care team are immediately dispatched.
We've been mobilised to a patient who's in cardiac arrest. We're about a 9-minute drive, so it may well be that additional crews arrive before we make scene.
In a cardiac arrest, every second counts. Without effective intervention, a patient's chances of survival decrease by 10% with every passing minute.
Thank you.
You have reached your destination.
The first ambulance arrives within a few minutes, followed soon after by Dr. Andy, Emma and Les.
Hi, guys. Hello. Hiya. The Lucas, guys.
60-year-old joiner, John, had been working in a customer's house when he collapsed. The homeowner and a neighbour managed to give CPR until the paramedics took over.
Oh, my. Right, can you stand over there? Is that all right? We just need a bit of floor space, OK?
Now the critical care team step in.
Right, guys, can you get the eye gel in?
Katie went in and then we lost rise and fall.
Right, can I ask a favour? Just to that, just to that, just to this, OK? And just one sec. That's fine, yeah, so do that every 6 seconds, okay? 6 seconds. What are we on, VF or on PEA?
We've been PEA, so it's been non-shockable. About to give adrenaline, I believe.
PEA, or pulseless electrical activity, means the heart isn't beating at all. In this state, electric shocks can't be used to restart it, so the team will have to rely on other techniques.
Are you happy with this access?
Yeah, we've had fluids running through fine.
They administer adrenaline through an intravenous cannula, which aids circulation.
Okay, adrenaline's in. If someone makes a note of that time for me.
So, do we think when the next pulse check's due, we could get him on the Lucas?
Yeah, sure. Yeah, that sounds good.
Next, the team prepares to deploy the Lucas machine, a device which mechanically applies chest compressions.
We've got the board and everything for the Lucas, guys.
Right, we're ready for the rhythm check.
Right, so we're going to lift him straight up and
So
under.
you check pulse. I'm going to lift up.
One.
Ready, go.
A back plate is slid underneath the patient.
Any pulse?
No.
Okay,
That's
continue.
PA back on the chest, Right, let's get the thing over, guys.
Once that's in place, the Lucas can be attached to the chest.
We're coming above you, just carry on, keep going.
Not clicked in here. There we go.
Clicked on.
Now activated, the Lucas pumps blood around John's body, preventing his brain from being starved of oxygen.
So at the minute, airway's okay, we've got capnography, we've got oxygen. Have we got enough oxygen in there? That's perfect. From a circulation point of view, we've got IV access, we've got the Lucas running, okay? Les, I'd like you on timing, so you keep all timings, all drugs, okay?
Alongside the chest compressions and drugs, the team are ventilating John by administering oxygen into his lungs.
30 seconds to next pulse check.
Dr. Andy's hoping it'll be enough to revive John's failing heart.
Right, pulse check.
Okay, we're going to stop here. Any pulse? Can you just check for nice carotid?
No, I can't feel anything.
Ambulance service, is the patient breathing?
Something happened to someone on the back. I don't know if it's I think it's a seizure. I don't know if it's an overdose.
Is he breathing?
Nah, he's just shaking like crazy, absolutely crazy. I hope he doesn't lose his life. I think he's having a seizure or an overdose.
Panic 53, just let you know, ETA will be around 10 minutes.
53, that's great, thank you.
It's the early hours of Saturday morning, and Dr. Jen Hardy and critical care paramedic Jenny Mealy have been called to assist an ambulance crew in the outskirts of Coventry.
We've been called to a patient who's potentially got acute behavioural disturbance, so they're quite agitated. Quite difficult because there can be quite a variety of different causes.
Acute behavioural disturbance, or ABD, is when a patient is behaving in an abnormal and highly agitated manner. It can be caused by intoxication, mental health issues, or a traumatic injury. When the critical care team arrive, the patient is lying in a bush and refusing to come out. Dr. Jen is briefed by a paramedic.
So we've got a gentleman called Jordan. He's 36 years of age, found back off his bike and was fitting on the floor. When we arrived, he was actively fitting.
Right.
Really hypothermic, bordering about 40, 41 degrees.
Right.
The man has a dangerously high temperature, common in patients with ABD. If it isn't brought under control soon, he could go into cardiac arrest.
But now he's just very aggressive, not with it at all, thrashing around. He does have a history apparently of psychosis and schizophrenia.
Okay, but he's also got a head injury.
Yes, quite possibly.
Okay. Jordan?
Jordan is in a potentially life-threatening condition. Dr. Jen must urgently assess him.
Hello, I'm Jen, I'm one of the doctors. I'm just going to have a quick look at your wrist, my darling.
Jen begins by trying to check his pulse, but it seems to cause him distress.
So is this the movement he's been doing since you guys got here?
Yes, more or less. So I've done some lashing out. He's sort of punched himself.
Yeah.
Punching the floor.
Okay.
He was speaking to his mum at the moment.
Okay, I don't think his mum's going to probably help this sitch at the moment. So I think we're probably going to have to give him some IM ketamine.
Ketamine, yeah.
Unlike the ambulance crew, the critical care team carry ketamine, a powerful sedative which should help to calm Jordan down.
What do you reckon he is, Jen? 70 kilos?
Yeah.
Right, so it's just over 5. It's about 5.5 mils.
Yeah.
When we cut his jacket, he did actually start to actively lash out towards us.
Okay.
While Jenny administers the injection, the others help to keep Jordan still.
Yeah, hang on, let me come that side of you, Jen, so I don't get stabbed.
What's that arm?
Yeah, got it. You're all right, Jordan. You're okay. You're all right.
Right,
You're all right, fella. Everybody off.
The ketamine is in.
Right.
Right, just
shot
leave
spin.
him, like, don't leave him, but just leave him. We don't need to fight with him for a minute.
But before it's had a chance to take effect, Jordan is up on his feet.
Jordan, come and sit down, darling. Come and sit down, darling. You're okay. Yeah, you're all right. Jordan, come and sit down.
Calm down, Froze. You're going to hurt yourself. You're going to hurt yourself. Calm down. You're going to hurt yourself. Calm down. Any pulse?
No, I can't feel anything.
In Birmingham, 60-year-old joiner John has been in cardiac arrest for nearly 20 minutes.
Okay, we're going to restart. Okay, restart.
Dr. Andy, Emma and Les are giving life support while they try to restart his heart.
So this is the next lot of adrenaline for him then.
While the Lucas machine applies mechanical chest compressions, they're giving adrenaline to support circulation.
Right, you stay there because I'm going to use this as a flush, okay?
5 seconds to pulse check.
Every 2 minutes, the chest compressions are paused to monitor John's heart rhythm.
Right, check the pulse, please.
That's VF, guys, so I'm going to restart, okay?
This time, the heart is in VF, or ventricular fibrillation.
So, I'm going to charge the defib, okay?
Guys, just step back, please.
That means it's fluttering and may now respond to an electric shock with a defibrillator.
Step away, guys. Shocking. So that's VF, guys. So we're going to have 2 minutes again.
But it doesn't regain its rhythm.
Les, you got a note of our next 2 minutes, have you?
Yes, mate.
So it's at the minute, so we just have to persevere with just go through the rhythm. Hopefully we'll get a ROSC.
The team need to get the heart to start beating again, known as a ROSC, or return of spontaneous circulation.
We've still got enough oxygen, guys.
Yeah, it's not to get another one just in case.
Okay, 5 seconds until the next. 2 minutes.
Yep, stopping.
Check, please.
Got a pulse? Yeah, got a pulse.
You got a pulse?
Yeah. Oh, it's very, very faint.
Okay, we have ROSC at 17:37.
25 minutes after going into cardiac arrest, John's heart has finally restarted.
Very, very faint pulse.
But he's not out of the woods just yet.
Might just be that he needs some blood pressure support, to be honest. So, can we get some dilute adrenaline, Emma?
Yeah.
1 ml of that in a 10 ml syringe.
Yeah.
John's blood pressure is low. At the moment, it'd be dangerous to move him.
He's got a really good jugular. I'll just go in his neck if you want me to.
Dr. Andy administers a shot of dilute adrenaline through a cannula into John's neck.
So we're going to put in 25 mics of adrenaline.
That's 25 mics of adrenaline then.
Okay, that's lovely.
His blood pressure gradually improves.
Blood pressure, 87 over 46.
Okay, so that's a bit better, yeah? Right, okay, shall we go, guys? And let's get him onto the back of the ambulance.
Right, stand back, ladies. Right.
At RAF Cosford, another team is getting ready for their shift.
She looks nice when she's clean, though.
Critical care paramedics Faye Pollock and Sarah Foley work for the Midlands Air Ambulance.
Ooh. I'll get another brush, Faye.
Though today, they're on duty in one of the charity's 3 road vehicles.
There we go.
For the next 12 hours, they'll be responding to critical emergencies across the region.
Ambulance service, is the patient breathing?
Yeah, he's breathing, yeah.
Is the patient conscious and awake?
Yeah, for now, yeah.
What's the reason for the call, please?
He's come off a bike, a mountain bike.
Okay, has he fallen far?
Maybe about 8-9 feet, something like that. He's basically hit a log and then he's gone flying. Landed on the back of his head.
What injuries does he have?
He just can't move. He thinks lower back or neck.
It's like numb.
You feel numb all over your body?
Yeah, it's numb.
Whiskey Alpha from 7068. Good afternoon, we are on channel, over.
A man has come off his bike in remote woods and says he can't move. With concerns that he may have a spinal injury, Faye and Sarah are dispatched.
It's a motorcyclist or an off-trail biker that has come off his bike on the trail. So he's quite far from a road, quite far from civilization by the sounds of it. And so it's going to be quite tricky to extricate him. So it's really essential that we help the crew out with an extrication plan and/or advanced analgesia.
The location Sarah and Faye have been given leads them down a narrow track.
Oh my gosh, wow. This is tight.
Oh, hello, crew.
From here, they have to journey on foot.
Is it straight down here, is it?
The scene of the accident is half a kilometre into the woods.
Well, if he's able to bike down here over this.
Oh my God, yeah.
35-year-old truck driver Dave was out for a lunchtime ride when he jumped over a log and crashed headlong into a hole.
He's complaining of pain in his neck and then like a numbness and almost burning sensation whenever you touch it.
Right,
but
okay.
He was moving.
Faye is briefed by the operational manager.
Is this where he's landed?
Not moving at all.
Is that because he feels as if he can't move himself or just because he's scared to move?
I don't think he feels he's able to.
Okay. Dave, hello. I don't expect you to turn around to say hello to me. My name's Faye. I'm one of the critical care paramedics and I've got Sarah with me.
Hi, I'm Sarah.
Dave, what we're going to do is, I know you're cold, but it's really important that we try and take some of your layers off just to see what injuries we're looking at here, all right?
Yeah.
Can you tell me if you've got any pain anywhere at the moment?
My leg that's on the floor,
your right leg that's on the floor?
It's at the top.
All at the top?
Right. From knee upwards.
Okay.
My neck hurts a lot all the way around.
Your neck does?
My chin.
Okay.
There's something not right. Like,
yeah.
When it happened, it took me a while before I could breathe. Yeah, like
to stop.
I couldn't speak or nothing.
Right, okay.
Dave is complaining of pain in his legs and neck. Faye wants to narrow down his injuries and work out exactly where he's been hurt.
Your left leg, can you move your left leg? Good man. Can you bend it right back next to you so it sort of shows me your right leg? Kick it out now. Kick it out.
Dave is able to move his left leg.
Can you bend it up towards your chest a little bit? No? You don't feel as if you could?
But his movement is severely limited.
Doesn't go? Doesn't, it hurts, okay. Can you straighten it and bring it out of the way? Just so that it shows me your right leg. You got hard socks on?
Yeah.
Isn't it just Star Wars and... Star Wars?
They're odd, but they're still a pair.
Okay. Any pain when I'm feeling?
Yeah. Yeah,
it's just numb rather than a pain. Okay.
In Dave's right leg, he can barely feel anything at all. It's a worrying sign.
We're going to take your helmet off now, Dave.
Faye and Sarah need to work out if Dave has suffered a spinal injury.
Do you want me to hold his head while you remove?
Oh, my too.
Sorry.
Oh, no, sorry. That's it. Lovely, 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 lovely. Let's just pop that in the head for a second. Sorry. Right, I'm going to have a little feel. Oh, you've got a good lump on the forehead there. Does it hurt where I'm touching? No.
No. Oh, as you go down the back, it does.
Okay. All right.
Yeah.
Just.
Roll round my neck.
All right. Okay. I'm sorry. I'm just going to come all the way down.
Any contact with Dave's lower neck is causing him intense pain, consistent with a serious fracture.
Good man, Jordan. Come and sit down then on the bed.
In Coventry, 36-year-old builder and ex-boxer Jordan is experiencing acute behavioural disturbance after falling off his bike. He's extremely agitated, causing his body temperature to reach 40 degrees.
Come this way, come on.
Jordan.
Unless Jenny and Dr. Jen are able to settle him down, he's in danger of going into cardiac arrest.
You're all right. Let's get
You're
him
right, my
that way
darling.
towards the cot.
Yeah.
Come on, Jordan. You're
okay, my
okay.
darling.
A ketamine injection they've given him has yet to have any effect.
Take some breaths, take some breaths.
Okay, ketamine's kicked in.
That's it. Let's get the cot.
Go get it now.
Suddenly the sedative takes hold and Jordan is becoming compliant.
Okay.
Jordan, you're fine. You're fine. You're fine.
You're fine, Jordan.
Get the cot in behind him.
Now unsteady on his feet, he's helped onto an ambulance stretcher.
Okay.
Right, let's get him up the cot. All right, Jordan.
Can we get that oxygen as well? Cool. Okay, let's go.
Although he's more subdued, Jordan's situation remains critical. His sky-high temperature needs to urgently be brought under control and any injuries treated.
Perfect.
Stand clear. Ramp is in.
Right, let's get some obs on, please.
We're turning the heating off, please. If anything, put it on cold. Thank you.
Get those off.
Suction ready to go. You all right on that, AD? Thank you.
On board the ambulance, the team are better able to assess Jordan's condition.
Try and pop some stickies on him. I suspect they won't stay on, because I suspect he's quite sweaty. I'm not convinced you're going to get anything, but you might.
While the paramedics attach the monitoring equipment, Dr. Jen carries out a top-to-toe inspection.
Okay, so we've got a load of abrasions on his knees, so he's definitely had some form of fall.
Jordan has cuts on his knees from falling off his bike. Although no other bruises are visible, he may have suffered a head injury, which would explain his erratic behaviour.
All right, my darling, okay. It's okay.
He needs to get to hospital as soon as possible.
Right, as soon as there's someone in the driving seat, we need to go.
Yeah.
Let's go. $260, I think.
In Coventry, 36-year-old Jordan is on his way to hospital. He's been experiencing acute behavioural disturbance, or ABD, after falling off his bike and possibly suffering a head injury.
We might need stuff on top of the pet, to be honest.
Although an injection of ketamine has calmed Jordan down a little, he's still agitated, and his body temperature at 40 degrees remains dangerously high.
So how much ket has he had?
So he's had 280.
Yeah, perfect. Can we get some Medaz? Is that all right?
It's just there. Can I have that drug bag, please?
Dr. Jen decides to administer an intravenous dose of midazolam, another sedative which will help to relax him.
That's one of Medaz.
Thanks, mate.
All right, fella. All right. No, don't knock my drugs over.
For now, the cause of Jordan's ABD is undetermined. Jenny and Dr. Jen need to keep him stable until he gets to the nearest hospital.
How far to Cov? Is it about 5 minutes? Or?
10.
I'll need to pre-alert this. I'm just going to let them know we're coming.
Jordan's condition is sufficiently serious that Dr. Jen needs to let the hospital know in advance.
Hello, is that Coventry Any?
All right, fella.
Hi, it's the doc on Medic 53. I've just got a pre-alert for you. It's a 36-year-old male who has got ABD. We think he may have fallen off a bike, and he's been very agitated since. He's incredibly pyrexial at 40 degrees. He's got a heart rate of 145, blood pressure of 141/58. I would recommend probably calling the anaesthetist down because he is incredibly agitated. Yeah, thanks, Sam. Bye. Okay. Okey-doke. All right, Jordan.
Despite the sedation he's been given, Jordan is still agitated.
Can you give us more? My dad's, please, yeah.
More medication is needed.
All right, my darling, let's pop these arms down. There we go.
You're in an ambulance, Jordan.
You're in an ambulance, Jordan. What's been going on tonight, Jordan? Eh? What's been going on?
Sit up. Do you want to sit up? Okay, my darling. Please don't break my fingers.
The ambulance arrives at University Hospital, Coventry.
We've got an oxygen cylinder.
Jordan is swiftly wheeled towards accident and emergency. There, the medical team will keep him sedated while they investigate the root cause of his behaviour.
People with ABD can often get injuries and that we're not aware of them because they don't necessarily exhibit any symptoms of pain. So they'll stick him through the CT scanner, see if he's got any kind of head trauma or anything else that could have caused this.
Ambulance service, is the patient breathing?
He is, but
Is the patient conscious and awake?
not really. No,
Okay, bear with me for a moment, please. I'm going to ask you questions. Is the patient breathing noisy or abnormal?
abnormal. He's very shallow breathing. He's hardly breathing.
Okay, and you can't wake him?
He's gone grey.
Right, so listen, you need to concentrate on what I'm asking. This is really important.
Yeah.
Okay, so you're telling me right now the patient is very difficult to wake up?
His eyes are half open.
Is the patient responding to you?
No.
Although the details are vague, a 999 call has described symptoms consistent with a cardiac arrest. Taking no chances, Dr. Simon Meredith and paramedic Nicola Howarth are dispatched, accompanied by trainee Ellie.
So we've got a chap in his 40s who is apparently in cardiac arrest. We've got no other information so far, so we're making our way there and seeing what happens.
It's a 10-minute drive to the location. When they arrive, 2 ambulances are already on scene.
Let's park here, grab the kit. What do we know?
Simon is briefed by a paramedic.
Apparently industrial-sized printer. They've been walking it down the stairs, so they've got it hang over the banister.
Yeah.
And it slipped through his hands and fallen onto his head.
Okay.
And then we've had loss of consciousness. Not sure on the duration.
Not cardiac arrest then?
No.
Okay. Leave the Lucas. Let's go and have a look. Hello. Hello, I'm Simon. I'm one of the doctors. What's your name?
Stephen.
Hi, Stephen.
49-year-old Stephen was helping to carry an industrial printer down the stairs when it fell over the banister and landed on his head. Since then, he hasn't been able to get up.
It's a rather large printer, isn't it, to drop on your head? I'm going to ask a few things and we'll decide what we're doing. So it's hit him. Where's it hit you on the head? Let's have a look. Okay, all right, yeah, big lump.
A blow to the head can cause serious injuries, such as a fractured skull or a swelling on the brain. Dr. Simon must assess whether Stephen's in any immediate danger.
And then a bit of a loss of consciousness?
We managed to get in this chair, and his head went up, and he was just like grey, and then he went like yellow, and he was like his eyes were going.
Right.
guys.
Ready for scooping?
Yeah, scooping.
3 miles away, the critical care team are dealing with 60-year-old John, who collapsed with a cardiac arrest.
Is all that clear for us to go out on a trolley? Wonderful, wonderful.
35 minutes after the 999 call,
Thank you.
they've managed to restart John's heart with a defibrillator. But he urgently needs to get to hospital for further treatment.
Get in your side, Emma. We need to get the scooping.
Sure, yeah. Can you get in? All right. I'm just trying to keep his arm out of the way. Sorry. I've got his arm.
The team are using a scoop stretcher to get him out of the building.
I think we're going to have to lift him up to get it under, to be honest.
Do you mind if I step over there and I'll lift it?
Do you want to lift one arm up each?
Ready, steady, lift.
There we go. And then shuffle him a bit over that way, and the board's under, so the board's come a bit under.
Although he's currently stable, John's condition could worsen at a moment's notice, so time is critical.
Okay, everyone. He'll be on up, okay? Ready, steady, up.
John is carried with the Lucas chest compression machine still attached, just in case he slips back into cardiac arrest.
Watch his arm, mate.
1, 2, 3. That's great. Steady, guys, steady, steady.
Okay, yeah.
Off we go.
Oh, careful.
Guys, so just 30 seconds of your time. Doing really well, by the way. So we'll get another dressing on that. They're going to do an ECG.
Yeah.
Before they can set off, the patient and equipment must be properly prepped.
Can we just get one up, just re-secure that IV access a little bit better?
I'm going to put some under his head.
I'm just going to put this arm up here so it's out of the way.
Guys, just you make your way there. That'd be great. Thank you.
It's just over 10 minutes to Heartlands Hospital.
He's strapped in okay, isn't he? Emma,
yes.
That's for Rob. If you can draw me some Rob.
En route, Dr. Andy administers a delicate balance of drugs. Rocuronium is used to paralyse John so that he doesn't fight the breathing equipment.
Do you want anything to settle him? Yeah.
Ketamine also helps to keep him settled. An hour and 15 minutes after he collapsed, John arrives at hospital, alive and stable. The combined efforts of the public, the ambulance crew, and the critical care team may have saved his life.
Right, you give me that.
Yeah. You all detached? Yeah.
Obviously, he's had quite significant event with his heart, and we think that heart attack, which is why he had chest pain before he collapsed. He's obviously very lucky that happened while he was with someone. And they've done bystander CPR, they've called the ambulance service. We've been there quickly, so he's had the best outcome that he could have, hopefully, by what we've done.
Just take some nice deep breaths. Calm down now, Dave. Calm down. That's better.
In a wood outside Stoke-on-Trent, Faye and Sarah are treating 35-year-old Dave, who fell off his mountain bike.
Round my ear really hurts, man.
What's he had, sorry, ladies?
Just paracetamol. We're drawing morphine up now and fighting.
Thank you.
Dave's experiencing severe pain in his neck and legs, as well as numbness, consistent with a serious spinal injury.
Right then, Dave, what we're going to do is we are going to roll you onto your back, okay? Then we are going to warm you up, because every time you're shaking, you're moving your bones and you're hurting yourself even more so.
Dave has been lying in the same position on the ground for well over an hour.
You all right this side, and then Simon with Faye maybe, do you think?
He needs to be moved, but it's going to be painful.
I'm just going to give you a little bit of gas and air, all right?
Sarah is prepping some Entonox, or gas and air, which will work as a powerful but short-acting painkiller on top of the morphine he's already had.
Dave, take some nice deep breaths of this gas. Go on, take it, breathe it in.
That's it.
That's it, and again.
Okay, latest blood pressure's come up nicely, so we'll be able to give 106.72. So we can give a little bit more morphine, but I think if we do the move now to get him warm.
Dave, take another 3 bigger, deeper, nicer breaths. That's it, bigger breaths. That's it. You are going to feel a little bit woozy. but it's only to be able to take you out of pain enough for us all to be able to move your body, okay?
I'm going to straighten first.
All right. Oh no, we got to get you out, Dave. Come on, relax, fall into it, Oh, yes, let's go.
Sarah carefully supports Dave's head, while the others roll him over.
Where's all the pain?
Okay, darling.
Okay.
Even with the medication, it's an agonising movement for Dave.
Okay, we'll roll now, okay? Ready, steady, roll. Okay, well done. Okay.
There you are, you're done, Dave, you're done. Right, I'm just going to create a pillow, ladies, because he's a bit hyperflexed, isn't he? So what our aim is to try and stop you from moving your head around, okay? Try again. What, Dave, when we do that?
Oh, my neck.
All in your neck still?
Yeah, right from my ears right the way to the bottom. It's like...
Okay.
Intense as anything.
The extreme pain Dave is experiencing suggests his neck could be broken, a condition which can cause paralysis of the lower body.
Okay, just take my hands for me.
Faye wants to check again whether he's experiencing loss of movement or sensation.
Can you unclasp your hand?
I can't even feel it.
You can't feel it, it feels numb. Can you squeeze my hand with that hand? Is that as tight as you can go? Yeah. Okay. How about if we do it with this hand? Unclasp your hand. You can't.
I can't now.
You just feel as if you're too cold or it's too painful or you just can't.
It's just like...
I can't do it. I'm trying, but I can't.
Yeah.
Okay.
Like really hard pins and needles is what it's like. That's what my whole body feels like.
Numb. Okay. We'll get you straight up to a great hospital.
Dave's loss of feeling is a worrying sign that he may have suffered life-changing injuries. It's essential to get him safely to hospital as soon as possible.
Got no other injuries or anything?
Not that we were aware of. A little bit of pain in his knee. He said he bashed his knee in the process. But...
In Kings Norton, Dr. Simon and paramedic Nicola are treating Stephen, who was knocked out when a printer fell on his head.
Right. It's a rather big lump of a thing, isn't it?
He's been unable to get off the floor, and the concern is that he could have damaged his skull or his spine.
Can we sit him up?
I was just thinking about doing a blood pressure on his arm without his jacket on.
Yeah.
As well would be.
Yeah, let's get his jacket off.
Blood pressure.
Do an accurate blood pressure, get him sat up, get him moving. Let me just have a chat with the desk. Let them know what's going on.
If they can get Stephen moving, the team will have a better idea of how badly he's been hurt.
You all right?
Yeah.
How's that feeling, sitting up?
Yeah, it's okay.
How's your head feel?
Yeah, not bad actually.
I'm Nicola, by the way. Can I just have another feel of your neck?
Yeah, of course.
Is that all right?
A feel around Stephen's neck uncovers no sign of a spinal injury.
Right, let's take this off your arm. We'll get a blood pressure. Can I roll this up?
Stephen's blood pressure is normal, but he's still too unwell to stand up by himself.
I think he's probably going to need a scan, but his obs are stable. There's unlikely to be a C-spine injury, and then it's just a case of managing the head injury, isn't it? So I don't think there's much that we need to offer immediately. Let's grab a chair and start looking at how we're going to get him out. Go from there.
Stephen's feeling sick and dizzy, typical of someone who's concussed. An examination in hospital will be needed before any other injuries can be ruled out.
Right, I'm going to dewire you so we can get you on this chair. Oh, you don't need to apologise at all. Your health comes first, doesn't it? There we go.
Right.
You get stand up? We'll be able to take you straight on your feet. We'll help you up.
That's it. If you get onto your knees, push yourself up then, can't you?
The team helped Stephen off the floor and into a wheelchair.
There you go. We're going to strap you in, get you out to the car.
How's that feeling? Yeah?
I'm going to come in ambulance for you, Steve, and then we'll get a taxi.
Right, have we got all the other stuff out? You all right? All good? I think we've got everything.
Right, okay.
Was it a good printer?
Yeah. Not worth it, that word. Not bothered about printer.
Stephen's condition is stable, so Dr. Simon's happy to leave him in the care of the ambulance crew,
All the best, my friend.
while the critical care team prepare for their next emergency.
Dave, you need to just relax now.
In a wood near Stoke-on-Trent, Faye and Sarah are looking after 35-year-old Dave, who came off his mountain bike and landed badly on his head.
Oh, my missus is not going to be happy with me, is she? Why couldn't I just have a normal Monday like everyone?
With a suspected fractured neck, Dave urgently needs hospital treatment, but they're more than half a kilometre from the nearest road.
Nars, hello, how you doing?
Hart, the hazardous area response team, arrives to assist with the extrication.
Hello, sir. We're ready to get you out of here now.
Dave, at any point that you feel like you're going to be sick, you're uncomfortable, you're scared, shout out loud, we'll stop, okay?
Dave is transferred onto a specialist stretcher, designed for challenging terrains.
Happy?
Then they begin the 600-metre walk to the nearest vehicle accessible path.
We've got a couple little rocks coming up as well.
Oh. Are you all right?
Yeah, grand.
Dave, are you okay? Yeah, a bit wobbly? Terribly uncomfortable, or are you holding on?
The Hart team do their best to keep the stretcher steady. But for someone with a suspected spinal injury, even small movements can be incredibly painful.
We can give you something a bit more for the pain if it is unbearable, sir.
We're about a third of the way down, Dave, so let us know. What do you think, Dave?
Oh, thank you, dear.
Dave opts for more morphine.
Oh, it's done as much as I'm going to do.
Yeah, all right, darling. Okay. We'll just keep going slowly. If you need any more painkillers, just tell us, all right?
Slowly and steadily, the team resume the walk.
Just nice and gentle.
It is steep, isn't it?
You can lift the trap.
Whatever would we do without the Hart team, honestly? Well done, you guys. Stu, just watch where you're walking, that's it, that's it.
When they reach a bigger track, the Hart team's all-terrain vehicle awaits.
That's it.
Ready, set, slide. And pause.
Sort of on, yeah.
Okay. It's just about.
Yeah, sorry.
From here, Dave will be taken to an ambulance and onwards to Stoke Hospital, where his injuries will be investigated. Faye and Sarah fear the worst.
I think for a 35-year-old chap to have an injury and lie in the cold mud and not move from a really awkward-looking position suggests that there's a significant injury to his spinal cord.
I think we were hoping that it would get better by getting him off the floor, pulling him straight, warming him up. I was hoping that he might, by the time we got him to the truck, that he'd be able to go, actually, do you know what, it was just because I was cold and in a funny position, but that didn't seem to improve, did it?